Hello everybody, my name is Ben Piperno, and as part of CS5310 I'd like to present my final project, which uses volumetric rendering, specifically the marching cubes algorithm. And what it does, it's a powerful technique that can turn a series of 2D images or a single 3D image into a 3D model, which can then be rendered normally. This is really useful for a lot of medical images. We might get small slices of human tissue that we want to take a closer look at. So in this case, let's examine, maybe this is a person's arm or chest x-ray. And if we look at each image, we might not be able to make much of it or of the shape. It might really be hard to make a decision about it. Instead, what we can do is we can iterate along every single 3D texel, or it's the 3D equivalent of a pixel, and we can look to see, is it within a boundary, a threshold that we set, and are its 8 neighbors possibly also in or outside of that boundary. And because each neighbor can be, or each of the 8 possible texels that we're examining be either inside or outside of that boundary, we can now determine out of 256, again that's 2 to the 8 possible different shapes. And what you can do is you can find a lookup table, and what's really interesting is that you can then formulate totally unique geometries for every single pixel along that is contained within this, what is called an isovolume, to construct an isosurface. From there, you can simply follow the normal OpenGL pathway or workflow to then display your final image of the 3D model that you've constructed. So in this case, I've got an example. This is that same series of 2D images that we saw before, and instead I've created a series of filters to construct a bunch of different iso volumes or iso surfaces that are now being represented. So this is the lightest one in value that is not 0, and we can see there's some interesting shapes going on, but we can't really see much there. So what we'll do is we'll toggle off some of these filters and see if we can take a closer look. So as part of my code, I'm going to press the F key and then open up a new command, and I'm going to toggle that ISO volume in this lower range. And now that we've done that, we can take a closer look and we can see that there's a few other shapes intermingled here. In this fake X-ray or CT scan, let's see, I've got some bone in blue and maybe some muscles in red, and I guess the rest of that tissue that we weren't quite interested in green. So what I'm going to do is also I'm going to toggle off this red muscle tissue, leaving just this bone that, if maybe this were a high resolution or a real patient, a doctor might be able to take a look at to see if there's anything going on with the bone. We can also take a look at the wireframe and inspect the geometry and see if there's anything else that looks out of the ordinary. And looking at it, all seems all right except for this small area here where something seems to be jutting in a little bit. And if I go back to fill mode, you can actually see that there is an indent in this bone. Now this suggests that there is a gap in the filters that we've set so far, or the ISO volumes, and there is some other mass present. And taking a look, it looks like we've covered, or we're missing a range between 211 and 239 of the image pixel value. So I'm going to go ahead and create a new ISO volume in that range. And just as we suspected, there is something in there that that doesn't quite match some of the other surrounding tissue. And so this is an example of some of the great techniques that you can use in medical imaging to help doctors and surgeons better understand the patients that they're working with for more precise surgeries and so on. Thank you very much.